Hello guys, hello everyone. This is Dr. Azam here, your faculty of anatomy at PrepLadder, and I'm proud to introduce Dr. Ram Parkash. He has cleared his FMG exam in this FMG exam, which was conducted on 28 June 2026. And I'm so glad you can see the happiness on my face also that he has scored 200 plus, and to be very specific, 211 in this difficult FMG exam. So, warm welcome to you, Dr. Ram Prakash. Heartiest congratulations. So, first of
Thank you,
all,
sir.
I would like you to introduce yourself proudly today.
Good evening, sir, and good evening, everyone. Myself, Ram Prakash, from Tamil Nadu, Theni, and this is my mom and dad. And yeah, as speaking, as sir told, it is very much pleasure to be sitting and speaking with sir. Actually, so I didn't expect this score, to be honest. To be very frank, I was just afraid of the paper. So there were a lot of video-based questions. We'll just speak about the status, but very much to be honest, I was just ranting to my mom and dad about the difficulty of the question. I was just not sure about the score, but expected somewhat score. But this is somewhat good and God's grace in it. So
That's nice.
thank you.
And I think whatever the score that you got right now, 211, that's a wonderful score that you have scored in this difficult FMG exam. But I should say that the greatest reward or a gift anyone can give to their parents is this result. And yes, of course, your pillars, your support, they're standing right behind you there. I can see the support because of which you actually got this score. We would like to actually hear a few words from your parents also. And please convey them, Dr. Ram, if they are comfortable. As you told, you're from Tamil Nadu. So they
Yes,
can
sir.
actually convey their feelings completely in Tamil, and even tell the other parents also to support their students who are not able to clear. Like today, there are so many students who did not clear. So I would like from the parents to convey them. So please inform them in Tamil only, if you can tell them.
Yeah, good evening, and this is Radhakrishnan. So when my son first told me that I want to prepare for the FMG in PrepLadder, I straight away accepted. But not knowing about your PrepLadder, but my inner heart told that it's a valuable course to be taught. So myself and my wife readily accepted to join in the PrepLadder, and my son, he put his fullest effort in preparing the FMG exam. The first part was, it seems he told that first part was easy, and second part was a little bit tougher. In fact, some video clippings were shown that he was not that much aware of the timing which they changed the video clippings. So I had a confidence that I told him and encouraged him that my son, you surely will get more than 210 to 220. So he, as I thought, he just crossed 210. So I'm happy about it, and happy about your PrepLadder this thing also. So thank you so much. Thank you.
Wonderful, sir. I was actually silently listening to your feelings, sir. These feelings as a parent that you have when your kids clear, that shows clearly on your face, sir.
Yeah.
Congratulations, sir. That's a big.
Yes, I am also very happy. Thank you. Thank you. Thank you.
Yes, ma'am. You are about to tell something.
ரொம்ப சந்தோஷம் சார். எனக்கு வந்து ப்ரீப்ளாடர்ல அவன் உங்களுக்கு ஜாயின் பண்ணதுல இருந்து இப்ப வரைக்கும் அவன் ரொம்ப 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 எஃபெக்ட், நீங்களும் அவனுக்கு நல்லா கொடுத்தீங்க, அவனும் நல்ல எஃபெக்ட் போட்டான். நாங்க 220 எதிர்பார்த்தோம், அதுக்கு 211 வந்தது. ரொம்ப சந்தோஷம். கடவுளுக்கு மிகப்பெரிய நன்றி. அவனுக்கு எஃபெக்ட்டுக்கு நன்றி, கடவுளுக்கு ரொம்ப.
That's really nice. Thank you, ma'am. And wonderful support that you have given to Dr. Ram Prakash today. So, Dr. Ram, that's really nice. A big, excellent gift that you can actually give to your parents that you have given them today. Yes. So, I'd like to ask few questions there, Dr. Ram, because you have actually cleared your exam with 200 plus. So that it can be a big inspiration to your juniors also who are going to write on the exam next time. So, yes. What was your strategy? When exactly did you start your FMG preparation?
To be honest, I just started my preparation after my graduation. I graduated on the 2025 December. Mm-hmm. The basic knowledge which I had was during my college years, basic anatomy, physiology. These knowledges were just in my MBBS years. And after that, subscribe to PrepLadder on my during my internship, the clerkship year. I just told my father that I have to prepare for FMG, so that he just bought me this PrepLadder elite plan. And I just started. By then I didn't much to study every 5 to 6 hours. I just used to watch a video a day, like probably 1 hour or 2 hours a day. And then I was not even consistent with that during my internship due to postings and on everything. I was not consistent with that. But to be frank, I just started after December. And after December, I was just consistent with the studying, and there were I have no Instagram and no Facebooks and everything to just avoid distraction. For 6 months, I just sat down and just revised the notes and everything. I just still remember the first video of watching yours, sir. The very first video, which I, after buying PrepLadder, I just watched your video of neuroanatomy, of explaining the every neuro pose and somatocytes, arranging each and everything. That was my first video of PrepLadder. I just remember still now, sir. And
nice. No, actually, that shows your dedication in your score. Actually, the way you left the entire social media, will be shouting behind the students to leave the distractions and all. But in this era, also, you have given that proper dedication to yourself, avoiding social media and all those things. Fine. Apart from that, can you please tell me, like, how did the PrepLadder help in your preparation? Like, what exactly is the thing that you were relying on? Like, you took the elite plan of the PrepLadder.
yes, sir.
In that, like, what are the exact things? Like, did you watch the complete main videos, or what was your main source of thing?
Yes, sir. So I know that I couldn't complete every main video. So what I made a plan was that I just picked out of topics which I was not up to the level. So I watched LRR videos, and which I'm not sure. I just went back the main notes to confirm what the concepts are missing, and just watched the LRR videos. And the very much part was that Q banks. The rather than like it doesn't matter like how many times we watch the videos. It is a matter of time. How much questions we practice. So the PYQs of PrepLadders and the Q banks were very much helpful for me. And the most important was the exam setting. The PrepLadder exam FMGE mock test was as 100% as the real exam. So I should really I was very thankful and surprised that like I have sat in the same pattern like how the exam used to be, the 50-minute mark. Even if I have completed the 50-minute, I should stay still for the very 50-minute mark and then wait for the next 50-minute mark. That was really a challenging task for me during the exam, sir.
Exactly. That is what we actually emphasize, Dr. Ram. Like, we'll be telling the students that, to write on the grand test, so that you'll get to know about how the time management will be there, and whatever wrong questions you have solved, you'll get to know like what are the concepts that you are lagging in. But we have observed, I think you also have observed, many of your friends, they'll be having a phobia in solving grand test. Like, what do you think? Like, why do they have that kind of phobia? And
even
yeah.
For my sake, like to be honest, like but my first grand test I took, I was really scared. So like I just completed nearly about 10 subjects out of 19, like just the basic ones. Like the first year, second year subjects. I didn't even start my medicine, surgery, or ops gynae. So I just went with my guts and I just gave the very first grand test. For my luck's sake, I just scored a decent amount, around 170s. So like I just thought because what if I just don't get above 150, that might push me down. But to be speaking, like when I gave the test, some questions might get because of luck. I know that, but the trust in myself. How do I put myself during the examination? Because like this FMJ exam really let me know one thing, sir. Like it just taught me a thing. The thing was like it doesn't matter how much you know. It does matter what you remember at the time of exam. Exactly. Under the immense pressure, like there was the exams ambience and the pressure surrounding us. Like it was too much. So like I could literally like the basic question. For example, in the exam, they just asked a video question about finger extension of posterior interosseous nerve. It was a simple video of 30 minutes, and they have shown the patient couldn't extend the finger, but they have tricked us by showing the OK sign to confuse us with anterior interosseous nerve. It was just a basic, he couldn't extend the finger, but they confused us with this kind of things. Like at that time, I remember like we should be very, very much calm and composed at the time. Rather marking wrongs, we should avoid it marking wrong. Even if we couldn't mark right, we should not mark wrongs. So I learned this from this exam, sir.
That's really nice. And that's a big, big, big input. You are exactly telling the feeling that you have gone through during the exam. And that is very much important for the students who are actually going to appear the exam next time. So please follow Dr. Ram. He has actually scored like 211 in this exam. And if that person is telling you the right feeling during the exam, what happened, you need to follow that one. Because the person who has recently experienced that one, he's telling that calm and composed manner is very much important attentively during the exam. That is what we are exactly telling the students, that don't go for that late night studies and all. Be attentive during the exam. That will actually really help in that one. Fine. Apart from that, Ram, like, fine, you are done with your preparation, you are done with solving the questions and PYQs and all. What was your revision strategy just before the exam? Did you had any particular specific revision strategy before the exam?
I had a mindset, sir, like at the month of May, I should be able to complete all my subjects. I should no more study a new concept. I was strong in it. Even though I know that there is a lot of concepts left behind, I was sure that I'm not going to learn more topics, because what I've learned so far was started to jumble apart. Like, we know that from starting from Jan till May, the first subject starts to forget and jumble. So I was very sure not to learn new topics. And since the month of June, I started to revise the subject which I was very weak first. So I have categorized myself with the subjects which I was strong and which I was weak. And I have focused more on the easy scoring subjects. So I used to cover the easy scoring subjects first. Like, say, like I was sure about the first year subjects and the ENT, psychiatry, anatomy, physiology, and biochemistry. I was very sure about that subjects. So I know that even if some more or less I could get out of the good scores in it. And the most difficult, like the most important part was medicine and surgery. So I started to give focus more on surgery, ops gynae, and medicine, sir. So I was made sure that if once I revised it, I'm no longer going back to the subject. So I have to make thorough of it. So there is no more going back to these subjects again and again. Even though we know that we'll just forget it. So I have made sure that I'm not forgetting it. I'm not forgetting it. So I'll never go back to the basic subjects. I've made sure strong in it, sir.
That's really nice. So that's a great, great input that we're getting from Dr. Ram. I think all the students who are listening to us, they should also actually take the inputs from Dr. Ram. In the comment section also, we have Dr. Faizan Wani. Your LRR video was on point, sir. Thank you, Dr. Faizan. And Himanshu, hi. If any of the students want to ask any question to our student over here, Dr. Ram, who has cleared this exam with 200 plus marks in FMG exam, so you can ask him any questions if you want to ask. I'm even seeing the chat box here. So Ram, that was like really nice input, really nice talking to you, and thank you.
Can I have a moment of thanking the faculties?
Yeah, that's what I was about to tell you, that it's your day today. It's the platform is all yours, the stage is all yours. You can actually extend your wishes to whomever you want to thank.
I would like to thank all the PrepLadder faculty, especially you, sir, in anatomy, as guiding us the easiest way. Even though there is a lot of mnemonics, I've been studying the easiest mnemonics about the pharyngeal arches and branches. I still remember the pharyngeal branches and arches to be remembered every single time about asking that. And I would like to thank Dr. Preeti Sharma, ma'am. Like, ma'am's LRR video was like literally the mini notes of the exams question which has been asked. Like, that was on point of precise. And very much thanks to Dr. Marva, sir, because I have gotten a lot of input from sir, like on how to approach a question, but also not from the exam point of view, but also from other perspective, like how to sit. Sir said this to me, like during the class session. Sir told this, like, practice in a way that you are not don't turn on your ACs or anything. Just sit in a plain fan and in a hot condition. You will be given this situation so that you know how to write the exams. Even though the easiest question might be a difficult one for you on that day. So this was like I thought, like, why sir used to say this at the time, but I still practice the same way, like to sit in the fan in the hot air. Like, it was a little bit difficult for me. And sir, don't take unnecessary breaks in between your exams. Sit like 150 questions at the same 15 minutes, and then take a break, and then start practice like your own exam. This really made me to sit in that real exam pressure, sir. So very much thanks to Sir Marva.
Okay, that's really nice. So that is really, really nice. And of course, after thanking all the faculties, yes, your parents comes first, they, because they are the one who have actually seen that
Yes, sir.
dream of making you
Like,
a doctor, and they have brought you to the, yeah, you're about to tell something.
like when I said like I just said that my father, like, I want to like start preparing for my FMG. Like I said, I have this PrepLadder plan, and he didn't even hesitate for a second to buy me this plan. And he didn't ask like what why can't you just go with some other thing. He just trusted me. My parents both trusted me. Like I had a dream. So like as a small boy, everybody have a dream to make their parents proud. From since then, like can I share my some personal?
Of course, of course, of course. You can.
Like to be saying that I have completed my 12th at 2019 batch. So
Okay.
at the time the NEET UG came just 2 years, and I just scored like around 424 at that time. 424, I don't remember the score, but 424, 426. But at the time, I just missed my college and government seat just by 20 to 30 marks by the marks. So I just couldn't get into the government college. Like at the time, I just felt like that, like this is a big much pressure for my parents to pay me in a private college and just sending me in abroad, and like they have been through a lot of struggles for me. So I know that, but even though I just interested in medicine, they supported my dreams and pursuing it. Even after completing my MBBS course, like after graduating, like they still may keep pushing. They are still keeping pushing me. So they are the reason I'm just still running this all scores. So yes, sir. And one thing about this GT, like to be sir, about what you're saying is that's true. It is important to give GTs rather than even the PYQs. Like it might help you somewhat, but GTs are very much essential for you. I just gave almost all GTs in PrepLadder, and I used to solve preps NEET PG questions and INI-CET questions mock test. So the pattern which we helped me was like the NEET PG pattern. I used to say my mom like that it was really difficult the NEET PGs, but nowadays they are increasing the standard of the exam. This time it was way too much, sir. Like the surgery topics and the medicine topics, they were just giving hints for us, just hints for us to find the clues, and the options were not even direct, sir. Like the options were not even direct for the exam. So give as much as GT as possible. Don't mind about the scores. Even I just for the last GTs, if I remember, like the scores were around 190s to 200, but the very least I got was like around like 150s. I was just shattered by the time. Like this 150 score, like might push you to lux, but you should practice a lot. Like the very first test I gave 150s, to be honest, 150s. Like I was just like this might be because of some luck, but I have to push myself to get this scores. So I just watched all the LRR videos and notes, and I reviewed what I didn't know the main videos, but I came back to LRR and the main notes. That helped me a lot.
That's nice. That's nice. That's nice. That's really nice. You have put your heart out there, your feelings out there, and I think I should congratulate you as well as your parents also. Yes, sir. You have got a wonderful kid. Actually, he has a lot of feeling for you. The way he expressed his feeling today, it comes out of a lot of effort. Actually, the way he expressed his feeling about the NEET UG, the way you people have actually supported him. Both of you have supported him. So he has a lot of feeling. Wonderful to have a kid like this. Congratulations. And once more, Dr. Ram, God bless. God bless you. God bless you. Lots of success in the future also.
Thank you so much. Thank you.
Enjoy. It's your day today.
Yeah, thank you, sir. Thank you. Thank you.
Thank you.